Today I'm in conversation with Dr. Stephen Linacre, who works for Lincolnshire Eating Disorders Service. Stephen is a clinical psychologist who has past experience of mental health problems. Hi, Stephen. Welcome.
Hi, Natalie.
Perhaps you could tell us a little bit about why speaking in this series is important to you.
Well, when I heard about it, I think it's really important to get the word out that anyone can suffer from a mental health problem. And I think when I heard that you was doing this, I thought it was an opportunity to be able to share and to provide hope to people that you can recover from mental health issues. And generally, people that do work in mental health, can manage once they've come through the difficulties of suffering from whatever mental health problem it is. So, obviously I wanted to be able to share my story, and I do share it in other forums at times, and even with patients when it's appropriate in their formulation, etc. And I do find anecdotally that it does help people to feel that you understand better, that you can acknowledge what they're going through. Obviously, everybody's mental health is different, but I think there are similarities, and I do think with people talking about it, I think it will eventually reduce a lot of stigma.
I think that's the way forward, isn't it? I think that's all we can do is try and open up these conversations. I wondered where you wanted to begin with your story.
Okay, so like you've already said, I work in an eating disorder service, but I've had my own personal experience of an eating disorder. I'm now 41, but this occurred when I was 16, and went on till about 25. My sort of problems with eating developed initially because I had a lot of bullying at school. I had a lot of bullying that was involved not only about being chubby and overweight. I look back at pictures now and I don't think, oh yeah, you were fat, but that's what children picked out on. But they also picked out on my mild cerebral palsy that I have, which, sort of has affected my left side and my coordination. So I was different. And I think children, when they see something different, they sometimes pick on it. And that, I think, had a big trigger to why eventually I turned to eating and to control things. So I was 15, 16, decided to go on a diet and had the support of family and friends. And I found myself quite good at it, or I felt as though I was quite good at it. I lost the weight, people started to give you praise, reinforcement to carry on. And it just went from there, and then I couldn't seem to stop. So there was problems in regards to overthinking about food, getting very strict and routine and obsessive. I remember that there was times where I wouldn't do things, socially because it involved food. I got very anxious if I didn't do my exercise regime. And I started to sort of exercise as well, thinking that was healthy. But that also became a problem as well, and having to count calories and, sort of do enough calories so I could eat something. Later on, it developed into binging and purging, but that was after the first time that I had to go in hospital. So I went in hospital initially about 17, and that was when I'd got myself to a really low weight and very seriously ill. And they didn't understand eating disorders, although the hospital where I was, it wasn't a specialist eating disorder service, it's a generic mental health. They were very lovely and kind and caring, but they didn't understand it. And I feel as though that, although I gained some weight, I felt as though that didn't help me mentally. So when I came out of the hospital, the eating disorder thoughts and returning to excessive exercise was still there. I'd not addressed the psychological difficulties. I remember after being in hospital the first time, so I had to go to the gym instead. That's how strong the mental health problem was. And obviously, like all mental health problems, it tests family and tests relationships. And you feel more and more isolated. And sometimes you just wanted people to listen and hear, but there was often quite a bit of, well, why don't you do this? Or why don't you do that? And sometimes that rubbed me up the wrong way. So in the end, obviously, I lost a lot of what weight I had gained the first time round, and then had to go back into hospital, which was a specialist unit, which was, a good 50 or 60 miles away from where I lived. And I was in there for 10 or 11 months as an inpatient, and then continued to travel down there as a day patient. And then after that had, I think, psychotherapy for a following year. But that was a good thing to help me to reflect on what may have triggered the eating problem. So the sort of abuse and the sort of the bullying that I had, all these things have obviously played into, but also social media and how being fat is viewed as negative. I think that plays into it as well. So I then managed to get my life back on track a little bit. I went and started to go back to college as an older student, but I went to college and did some A-levels and did some part-time work in a Mecca bingo club, which was very useful at helping me to get more confidence in front of people, because I was having to fall them in. But I think for a long time my self-esteem suffered. It was something, obviously, and I think even now, people with mental health problems or have had mental health problems, your self-esteem can still be fragile. But it's about sort of believing what's in your heart and your values as what you want to do.
Yeah, absolutely.
And I think what happened then is I decided, because I did psychology A-level, I decided I wanted to do psychology degree, went away and still had eating problems at the start of my degree, but I think that was really helpful for me to get away from home and try to be a bit more independent, and it was helpful for me to develop sort of friends and people that perhaps didn't know me beforehand. And it was helpful as well to have that social pressure. Sometimes when you're in some places, sometimes it can be very unhelpful, but other times it can be very helpful to people to have somebody that's not directly involved in your family or people that know you. And it encouraged me to take risks with eating different things rather than being routined and stuck. And over time, I also, you transferred your coping strategies to other issues. I've experienced issues of self-harm in the past, and overcome that too. I think it was all about trying to cope with difficult feelings and not knowing how to sort of express them in adaptive ways. But over time, and I say it took years really, you learn to sort of have a better emotional regulation And it was after my psychology degree that I decided that I wanted to go into psychology as a profession. And I suppose it developed from there. I think, initially after, doing the doctorate, as you're probably aware, for me was one of the most difficult things in my entire life. But you achieve it with persistence, and some of those characteristics and personality styles that I have that made the eating disorder stronger have actually also been things that have helped me to develop good things in my life. So when I talk about persistence and tenacity and hard working and conscientious and being thorough, all those things were things that obviously got worse as the eating disorder got worse. But they are also things that now are valuable qualities that I have to be able to do my job and be able to sort of work with clients. I did start off my qualified sort of career in mental health initially in a IAPS service. And I did worry at the time about whether that was the right thing to do, but it seemed to go okay. But I had a passion for learning disabilities, and the reason why for that is, I suppose, is also because of my physical disability and how that you get stigma with that as well, and feel as though people might judge you, or sort of you can't do the things that somebody that's able-bodied can do. And I suppose in learning disabilities, there is a lot of trying to help people to get back into the community and be accepted. And I think that was something why I wanted to do that. But my work in eating disorders continued, not in job-wise, but through voluntary work, through doing voluntary work for BEAT, and also being a chair of an eating disorders charity that's local. And also I wanted to support carers, because I understand how, like my mum and dad who went through hell and back with the eating problem, and how to support it. They need to be knowledgeable and understand mental health problems so that they can help in the best way that they can. And I think services should be able to support carers and parents be able to do that. And obviously that requires education. So a lot of my career has been trying to support that area as well, in being able to deliver training and support carers to look after their own well-being too. My doctoral thesis was around carer well-being of people with severe and enduring eating disorders. And we know that up to 50 to 60% of carers can suffer their own mental health problem due to the burden and the strain that an eating disorder can put in the family environment.
And so you kind of were working in learning disabilities, and then you were doing some volunteering work and were the chair of this trust around eating disorders. And you now work in the area. How did you know when you were ready to do that?
I mean, people have asked me this before, and I think it's something whereby sometimes you have to be pushed, I think. What I had was the situation where I was on fixed term contracts. I saw the job come up. I knew that I was knowledgeable about it and had stuff to offer. But I think if another learning disability job had just been there, I probably had gone that way. Because you do worry about, well, if I'm so close to this, will it re-trigger things? Mm-hmm. But I'd always, tested my foot in the water with obviously doing carers work and doing that voluntarily. and I didn't find that triggering. I bit the bullet and tried it. And I think, there obviously you're adapting when you change specialities. It's always very daunting and anxiety provoking anyway. But if also you've had the same mental health problem as your clients, it can be worrying as to how perhaps colleagues might take it, or when you're at interviews. I mean, I know now on job applications, it often says experience of a mental health problem as desirable, but I know not all trusts are like that. The people I work are very supportive and actually value that I've been a service user, not with them, but somebody that's been on the other side, really. I think it's something that's valued, and that perspective is important, I think, when you're providing and developing services.
Do we see that across the board enough? Do we see that across the professions who work in mental health, do you think?
I don't think so. I think it's something that we need to be better at, particularly, in the NHS and private sector. And I think, we don't need to be looking at as, well, we're a mental health professional, we're the expert, we know it all, we don't ever have any problems, because that's rubbish. And I'm sure you're aware, do you know what I mean? And it's like, well, there's places and times with how you do it, but I think that human connection needs to come across. And the fact is that we all suffer difficulties in our lives, no matter what it is, and no matter who you are. And I think sometimes if you get a professional from a service user's perspective, the professional can appear as though, right, I want to just be like them. They seem to have no issues. They seem to have no problems. They can manage everything. And I think, not that you go out and say, right, this is a list of my problems. Of course you don't. But I think it's acknowledging that there are difficulties, there are ups and downs in life. There are ways to navigate things, and you've had to, if you've had that experience, I think it's extremely valuable.
Yeah. So how's it been? How's it been working in there with eating disorders?
It has been a challenge, and I think particularly now during the COVID-19 situation, what's occurring, it's been even more difficult. And I think, from a personal point of view, I think clients do value my honesty and being able to be sort of get down to their level. That level of empathy, I think, is much deeper. That doesn't mean to say people that haven't had a mental health problem can't empathise. The clients seem to do get some value and hope out of being able to say, yes, I can see where you might be coming from, because I've been in a similar situation or whatever. But like I say, you take it on a client-to-client formulate, when you've thought through their case as to whether this is something that's helpful to them. It's not, and obviously it's not my own therapy or me being able to offload stuff. It's very much what's best for the client. And I think it's something that people do want to feel safe and comfortable in the therapy room. Sometimes you've got to break down that initial resistance and that initial sort of unwillingness to open up about it. But obviously not everybody is willing to, people do present to services, and sometimes they're not ready or willing to get better. So, it's not something that obviously I use with everybody, and it's not something that is the main part of, my therapy, but it's something that, and it's another tool in the box that I think can be useful. And I suppose
Sorry, I was just going to say it's a very particular frame, the therapeutic frame, isn't it? So when we're talking about sharing, there's kind of general sharing, you know, amongst peers and colleagues and within teams, and during training, and being able to kind of be compassionately met, and for the value of lived experience to be seen. And then there's the therapeutic relationship, which is a very particular setting in and of itself, where you're right, that lived experience is a particular tool that might be helpful in terms of engagement, I guess.
I mean, in terms of sharing in teams and, you know, doing training, it's been very helpful in the training I do. So I'm involved with training teachers and staff that work with young people to recognise possible eating disorders and understand what an eating disorder is. And the feedback I get from them, because they do evaluation, is that they enjoy and it helps them understand better being able to offer snippets of my personal, you know, story and, my, you know, so I think it's very much more, it's definitely helpful in all training I've done. All the training I provide on eating disorders, I will share it. I think people understand, you know, they like a personal element to it. I mean, obviously, sometimes we get service users to come to that training as well, that consent to do that. But I think when you're explaining something about a mindset or a particular behaviour, you know, they can read textbooks about that. I think having that personal person there and being able to ask those questions, I think helps improve the teacher's learning that I offer. And that's through the service evaluations that we're doing. That's the feedback we're getting.
Yeah, that sounds brilliant that you can bring that in, and also that you felt ready to bring that in. I think there's the timeliness and a readiness of the person to feel emotionally safe to share.
Well, I mean, obviously, I've gone through my own therapy over the years, and I do feel as though it's not something now that particularly emotionally affects me. You know, there's components of it that I still keep to myself, but there's bits where obviously you can add to when you're explaining, let's say, the eating disorder psychopathology, you can explain how that was triggered for me. Everybody's eating disorder is different, but obviously there's common themes. And it's the same with any mental health problem. I mean, whilst I was on my training, just going back a little bit, I did also develop generalized anxiety disorder. And I think this is where I think there's a lot of overlap with all mental health problems. And it's thinking about, well, okay, you know, you may have one mental health problem and you may have to go through trying other maladaptive coping strategies before you get to the adaptive ones. So like I said, with during the eating disorder, I did some self-harming, which again, you know, if somebody asks me what's the mark on your arm, I will, you know, share that, particularly in training settings and colleague settings. And obviously, it's more, you have to think more carefully about whether, you know, if somebody says to you, but you don't want to lie to them either. Do you know what I mean? So let's say a client says, what's that scar on your arm? You know what I mean? It's like, you've got to think carefully about how you say that. Because I'm not for somebody saying, oh, I'll make up a story. It needs to be genuine, what you're saying. But obviously also you don't want to distract away from the work that you're doing with them about. It's their therapy, it's not. So it's getting that balance. And I think talking about things, I think, needs to be done more, because it will remain something that, oh, that it's them that get that. It'll be an us and them sort of, you know, environment if you don't continue to realise that everybody's in this, or potentially everybody can be in this. Everybody knows somebody that's got a mental health issue, even if they haven't had one themselves. It's just, it's one of those things that seems to be overlooked in certain environments and just swept under the carpet. And I don't think, obviously, that's not helpful to anybody.
I think kind of what you're sharing with us is really powerful to hear it from you, and how your mental health difficulty has moved alongside you, I guess, in different ways in your life, and then the career that you've chosen, and how you've had a relationship with it in different ways during your career, and looking back, and how, you know, it's not something that pains you anymore, and you know, this kind of
certainly I wouldn't be,
journey that you've been on.
Yeah, certainly I wouldn't say, oh, I wish I'd never had it. I mean, I know that sounds odd because I've gone through a lot of pain with it, but I think part of it, I wouldn't be the person I am today if I'd not gone through all that. So, you know, I mean, it says, all right, looking at every opportunity, what the silver lining is. And obviously I would never sort of, you know, wish anybody has to go through anything like this. But it does make you more resilient. It does make you more reflective. It does make you understand yourself better, and also allows you to potentially get to better places in your life because of what you've experienced. So yes, it's part of my past, and a lot of it's very personal, and you have to tip and choose, well, what's best to share and what's not best to share, and how you word it. But I think everybody that has experienced a mental health problem should have a good think about as to why not. You know, why not share it? You know, what are they fearful of? What are they worried about if they do? Now, obviously, if somebody's still going through it, then obviously there's reasons why you might not share it. And you may need just professional help. But in terms of if you're a professional working and you've gone through something in your life, and it's helped you, then what is the problem with talking to colleagues about it? What's the problem with even bringing it into your training or into your work? Because it's something that does happen to many, many people. And I think the more that our client group know that, the more that it will encourage them to seek support.
And feel less alone as well. And for us to feel less alone with it, because there's nothing like stigma for kind of dividing people up and separating people and isolating people and feeling like you're the only one, you know. And you know, what you said really resonates with my journey as well, about it having this sense of transforming something in my life, although again, I wouldn't wish the pain on anyone. And a sense of why not? Why couldn't we be talking about these things? With obviously thinking about kind of options and choices around sharing, and you know, like you said, and particularly in the therapeutic frame, where the sharing has a different intention about it. But it's been really wonderful to hear your story, Stephen. And is there anything else that you would like to share before we end?
Well, I suppose obviously the only thing I would is obviously say in this, you know, it's unprecedented time of COVID-19, and how obviously all our ways of communicating with people is changing. I still think there are still opportunities for people that have had mental health problems to be able to still come out, like obviously what you're doing. And I think it's something that people need to have a think about themselves as to what would be so bad if they did it, or what would be so wrong if they did share it with people, so that other people know. Like you say, there has to be boundaries, but I think COVID is obviously something where it's going to potentially be increasing more mental health problems, with the lack of contact with people, the isolation, the more that people are going through and thinking more in the head rather than being able to contact socially. These things encourage mental health problems, whereas a good anecdote is being able to share and be able to talk. And yes, we may not be able to meet people, face to face as much. Hopefully that will change soon, but at the moment we'll not be able to. But there are other ways of communicating, and I think if there are people watching this, then it's their choice whether they do it. But I think, from my experience, it's only been things that have been very good for me. And I would encourage people to consider it, whether it'd be good for them.
Yeah. Thank you so much. And I was thinking about connecting during this time and even doing this whole series, really, that has come out of lockdown. It's another way to connect, isn't it? And keep the message going whilst all this is happening. So yeah, and I look forward to positive changes there in the future, all being well. Thank you so much, Stephen, for
Thank you.
sharing, and look forward to keeping in touch.
Thank you.